COVID pandemic brought our world to a grinding halt, exposing the vulnerabilities of healthcare systems globally and highlighting the inequities in addressing healthcare challenges. Now, while the COVID-linked restrictions have lifted and life has almost returned to business as usual, many warn that pandemic preparedness has probably not received the attention and resources needed. While science and scientists came through, be it vaccines or therapeutics, the response to distribution was grossly inadequate and inequitable. The pandemic also exacerbated the mistrust in government and multilateral institutions, with the call for reforms picking up pace. With geopolitical risks overtaking the pandemic panic, experts worry about a setback on the healthcare agenda. Joining me now on the Global Dialogue today is a man who has spent his career researching and deconstructing public health policy. Please welcome Dr. Ashish Jha, Dean of the School of Public Health at Brown University and the former White House COVID Response Coordinator. Dr. Jha, many thanks for joining us here on the Global Dialogue. It's wonderful to have you here on the program and in India.
Thank you so much for having me, and I am delighted to be back in India for the first time since the pandemic, and it's just good to be back home.
I want to, before I talk about the pandemic and other healthcare challenges, I just want to address your view on India. You know, it's been quite a journey for you from Bihar, which is where you were born, to Canada and then to the US, where you now reside and where you've built your career. As you come back to India, in your new avatar today, what are your thoughts? How do you see the country and what it has become?
This is certainly a very different country than the one I left when I was a child. And it very much feels like a country on the move. While no country was perfect in the pandemic, there were a lot of innovations that came out of India. And returning now as the pandemic fades, it really does feel like a much brighter future for health in India and for India overall.
As you look back at what we've been through over the past 3 years, and more importantly, how prepared we are for the next pandemic, which, most health experts tell us it's a question of timing and not if it's actually going to happen. Do you believe that we are better prepared today? Have we learned the lessons from the COVID pandemic?
Yeah, so there is no question in my mind we are better prepared. If the question is, are we as a world, or is India or is America as a country adequately prepared? I would say no. There is more work to do. But are we better prepared than we were in 2019? Absolutely.
You know, speaking of the work that needs to be done, and I think, as I pointed out at the start of the program, the big challenge that the pandemic threw up was the inequities in our healthcare system, not just in the availability of vaccines, but when the vaccines were available, in the distribution of the vaccines as well. What do you believe the approach now needs to be in being able to learn from that experience? We're talking about the mRNA vaccine and, the Nobel Prize winners this year on account of the work that they've done with the mRNA vaccines have been recognized. But is the world and healthcare systems globally, administrations globally, looking at how we can actually make use of the science that is available to us?
Yeah, this is a fantastic question, and I will say a question that doesn't get asked often enough. It is undoubtedly true. We have built these mRNA platforms. They're fantastic for COVID vaccines. They're going to give us many other vaccines, and that's great. But vaccines unto themselves don't do anything unless you can distribute them, unless you can get them into people's arms. And when I look at countries that did very well on distribution, the first country I think of is the United Kingdom. Why? Because they have a fantastic national health service that was able to quickly distribute it. I actually think India did very well in distribution, but there were some challenges, as you said. And the solution there is really building out our healthcare infrastructure.
Since we're talking about vaccines and distribution, one of the other issues that got highlighted on account of the pandemic was the raging debate, or I would say the ongoing debate on patents and IP and healthcare costs and the access issue or the access deficit. Where do you believe the world stands on these issues today, specifically in light of the fact that multilateral institutions have lost a lot of the heft that they enjoyed?
Yeah, look, pandemics have a profound impact on almost every institution. They certainly have had impacts on governments, on these multilateral institutions. Here's kind of my big picture thinking about these issues of IP distribution, vaccine production. First of all, I very much supported waiving IP rights for vaccines. I think these vaccines are extraordinary. We want companies to develop them. We want companies to make money. But at the end of the day, they have to get out to the world as quickly as possible. And waiving intellectual property rights for a vaccine in the middle of a pandemic made a lot of sense to me. It's the position that President Biden took, and I think we made progress there. I think that's one issue, but IP alone doesn't solve the problem. There's also the distribution and distribution of manufacturing. If you look at the place that built almost a very large proportion of vaccines for the world, it was the Serum Institute here in India. Incredible capability. The question is, how do we expand that capability beyond Serum? How do we create partnerships between, let's say, Serum or Bharat Biotech and manufacturers in Africa or in Latin America? This is the kind of work that needs to be done now so that we have distributed manufacturing. So the next time there's a crisis, we're not just looking to one or two or three manufacturers, but that we have manufacturing around the world.
So who does that? Who takes the lead in that? Do we leave it to the private sector? Do we leave it to Serum and Bharat Biotech to go out there and ink commercial agreements? Or does the government take the lead? I mean, who gets this done?
Yeah, it's a great question. So in my view, complicated problems like this cannot be solved by any one sector alone. Government alone can't do it. Nonprofits or multilaterals alone can't do it. And the private sector alone can't do it. And so you really need to bring them together. You need to create financial models that make sense for the private sector. You need to have that kind of regulatory cooperation. So this is hard work. This is not going to be easy, but I think it is very doable if government leaders, if multilaterals like WHO and the African Union and others take a leadership role. And then, of course, you have to have companies like Serum or Moderna or Pfizer or others also at the table participating in the process.
But do you know, and there's two questions that I have for you here. Do you believe that given the many challenges that the world faces today, whether it's inflation or it's geopolitics, you know, 2 wars at this point in time, virtually that leaders are dealing with, do you believe that the healthcare agenda has sort of been pushed back on the list of priorities? You were part of the White House as the response coordinator for COVID, so you understand the many complexities that governments need to deal with. So do you fear that given what is happening in the world today, that pandemic preparedness or healthcare investments are likely to be pushed back on the list of priorities?
This is a very good question, and I worry that some countries will do that. But here's the bottom line. It is incumbent on those who are in health to remind our leaders, yes, there are crises, what's happening in Ukraine, what's happening in Gaza. Obviously, there are other challenges like climate change, inflation, economic issues. Those are all important, and obviously they're going to have to focus on those. But health has to be part of the agenda. Health is critical to economic growth over the long run. Underinvestment in health harms economic growth. Obviously, spending is going to have to come down from COVID levels. We all understand that. But we have to continue making investments in health because the benefits are so substantial across all sectors. And I'm seeing actually quite a bit of receptivity to that. Obviously, it's not going to have the same priority it did 3 years ago. That makes sense. But making sure it's still on the agenda, still on the list, that's a case we have to make, and I have found in the U.S., I have found elsewhere, I've been visiting with government officials here, I have found a lot of receptivity to that kind of argument.
Well, that's good to hear. The second part of my question linked to what you just said, that we need to get all stakeholders to the table, including the likes of Pfizer, Moderna, Serum, Bharat Biotech, to name just a few. But do you see a willingness, especially on the part of Big Pharma, let's be honest about this, to come to the table?
Yeah, look, I think my experience, again, at the White House was we interacted with the pharmaceutical companies. They understood that in a crisis, they had to be at the table, that they had to be willing to show up. If you think about the mRNA vaccine, so much of that was developed with funding from the U.S. government. They understand that governments can play a very, very large role in these moments. and that they have to be a part of the solution as well. So I have never found that if you frame the question in the right way, and if you frame the issues and remind them of the importance, I have consistently found that they are willing to come to the table.
So how would you frame the question today? If you were to bring all stakeholders to the table and you were to pitch this to the likes of Pfizer and Moderna, how would you frame the question to get them on board?
Yeah, so what I would say is, look, the crisis of COVID may be receding, but there are other important health crises facing the world, and distributed manufacturing, making sure manufacturing of vaccines and treatments are happening around the world, is a critical priority. And so we need companies, many companies that have actually gotten substantial amount of resources from governments to at this point step up, be involved in technology transfer, be involved in know-how transfer, build these manufacturing plants in places that don't have them. Obviously, India is in a place where we actually have a lot of capacity inside India. I think the major producers like Serum and Bharat Biotech have to be part of that same conversation. I think we have to remind these companies that if they walk away now, in the next crisis, they will need government support. They will need government help. They will need government funding. This is a long-term partnership. It's very important that they play a role right now.
Well, you make an important point, but the question is whether we're going to see this messaging from governments to the private healthcare sector and to private pharmaceutical companies being made as clearly as you just framed it. We are going to take a quick break here on the Global Dialogue and return to our conversation with Dr. Ashish Jha in just a moment. Stay with us. We're back in a second.